In this area, submandibular region, fat gets accumulated in two different layers. One is the skin layer, which is a superficial layer, and the other is a deeper layer. We call it a subplatysmal layer, wherein it is between the muscles, and this fat is a little difficult to reach. Hello, I am Dr. Dushyanth Kalva from Inform Clinics, Hyderabad. Today, we are going to discuss a topic called double chin correction. So, what is double chin? Why does it need to be corrected? And also, how it can be corrected. So, I think these are the relevant topics that goes through anybody's mind. So, let's come to what is a double chin. So, double chin is nothing but an accumulation of fat below your jawline. We call it a submandibular region. This triangular region between the neck and your chin is called a submandibular region, and whenever lumps of fat collect under it, that appearance is called a double chin. Now, why would somebody want to get a correction of a double chin done? Surely it's not a harmful thing, or it's not going to harm you. The reason lies in aesthetics. So whenever we see a person with a nice, sharp and strong jawline, him or her, we ascribe a sense of beauty to that appearance, and we also ascribe a sense of strength and health to that person. So a person who doesn't have a double chin, who has a sharp jawline and a strong jawline, so such a person will automatically appear good looking, strong and healthy. So this is the reason why subconsciously many people aspire to get their double chin removed. So that is the reason for it. So now let's come to how it can be removed. So before that, we need to know that in this area, submandibular region, fat gets accumulated in two different layers. One is the skin layer, which is a superficial layer, and the other is a deeper layer. We call it a subplatysmal layer, wherein it is between the muscles, and this fat is a little difficult to reach. So now coming to the treatments. So the easiest treatment from which you will recover very quickly, the surgery is short and it's usually done in a daycare setup, is called a submandibular liposuction, or just a liposuction to remove the double chin. Herein we remove the outer layer of fat that is directly under the skin. This fat can be suctioned through tiny incisions around 5 mm, either behind the ears or just behind the chin, as the case may be. So with this, most of the skin fat is gone. So in many people, in the majority of people, this gives a very nice and flat appearance, and hence the double chin problem is solved. But in a few individuals, the fat is also present in the deeper plane. So the deeper plane fat is called interdigastric fat, along with laxity in platysma muscle, submandibular gland, subluxation, so on and so forth. These are all the technical terms that we use to describe a slightly aging and slightly aged appearance in this region, that is occurs due to presence of fat in the deeper plane. For this, we do something called a lower facelift or a neck lift procedure. This is a slightly more complex procedure, requires a little more time, but at the same time, it can give very, very stunning results. So a liposuction is a basic minimal procedure that we do, which is very, very common, followed by a neck lift or a lower facelift, which is slightly more complex procedure. So between these two procedures, I think we can get a very good jawline with a complete removal of a double chin. I hope this video has given you adequate knowledge, and you should realize that such videos are only for educational purposes only. So if you are seriously thinking of getting any surgery done, such as a double chin removal or anything like that, please be sure to consult a qualified cosmetic and plastic surgeon before you go ahead and step into it. Thank you, and don't forget to like or share this video.